Hello.
Yes, it's already here. It's Anna Soldić from Croatia. Okay, so very good, Anna, to see you here. Please share your screen. Yes.
Thank you. So today I will be talking about health benefits of royal jelly and its use in children's apitherapy. My name is Anna Soldić, as I already said. I am the head of a laboratory at Apitherapy Croatia, and my title is Master of Nutrition and Food Analysis, Food Science. So the aim of our study was to present a review of available research studies on royal jelly and its health on children's apitherapy. Even though there are not many papers on the effect of royal jelly on children's health, we have gathered available papers published in the recent years. So royal jelly is one of the most appreciated bee products with very complex structure. It is a viscose substance produced by mandibular and hypopharyngeal glands of young worker bees, which is essential for feeding and raising broods and queens. And this is the reason for the first 3 days, royal jelly is used as a food for all new larvae. And after the 3rd day, only the larva of queen bees continues to use royal jelly as food. This is the main reason that changes the gene expression and brings to alternation in lifespan. It has been used, royal jelly, since the ancient Egypt as a dietary supplement, and today interest in royal jelly is in constant growth. It is widely used in pharmaceutical, cosmetic, and food industries. In 2016, International Organization for Standardization has published ISO 12824 royal jelly specification norm, which specify the production and sanitary requirements for royal jelly and gives organoleptic and chemical tests method for quality control of royal jelly. But also it has given the recommendation for chemical composition of royal jelly. Thus includes moisture content of 62 to 68.5%, minimum of 10 HDA 1.4, protein content in range of 11 to 18, total sugars from 7 to 18%, total acidity from 30 to 53, and total lipids from 2 to 8%. The most important lipid of royal jelly is 10-hydroxy-2-decenoic acid, also known as 10-HDA, which has many papers covered by its immunomodularity, anti-diabetic and antibacterial, and also anti-cancer effects. Storage of royal jelly plays an important role of its key in preservation of its key components, such as royal jelly and proteins. And according to literature, the most of royal jelly, fresh royal jelly, is stored in freezing state before selling. It is packed in small and dark colored bottles, but the best way to preserve royal jelly is by lyophilization. Due to lipid oxidation, the content of lipid decreases over time, while the protein content increases. Royal jelly contains 8 out of 9 essential amino acids, among which the highest concentration takes lysine, proline, and glutamine, and the only one missing is tryptophan. The main minerals are potassium, sodium, zinc, copper, iron, and calcium, and the main vitamins are B-complex vitamins, vitamin C, and vitamin E. There are also others present, but in minor concentrations. The main sugar present in royal jelly are composed of fructose and glucose in ratios similar to honey, in approximately 13.9%, of which 90% consists fructose and glucose. Minor amounts, they are found sucrose, maltose, and trehalose. Health benefits of royal jelly. There are proven effects of immunomodulation, cardiovascular, central, and vegetative nervous system. Royal jelly has an antioxidative effect, antibacterial, antiviral, and antifungal effect, but also an anti-aging activity. There have been papers on positive effects on patients suffering from respiratory diseases, diabetes, and cancers. And in children, there are positive effects on general condition of young athletes, children suffering from systematic lupus erythematosus, also known as SLE, malignant disease, and in infants with nutritional deficiency and premature babies. What I think it's important to say is that today there are 12 health claims registered in UA, Register of Health Claims, but none of them are yet approved. Anti-diabetic effect. Diabetes is a disease characterized by elevated blood sugar, while the diabetes type 2 is a chronic metabolic disorder caused by insulin secretion disorder and insulin resistance. Royal jelly significantly reduces the serum fasting blood glucose and serum glycosylated hemoglobin levels and increases the insulin levels, which further reduces the risk of micro and macrovascular complications. Royal jelly also increases the serum apolipoprotein A1 and changes the apolipoprotein B, apolipoprotein A1 ratio in patients with type 2 diabetes. Research has shown that long-term administration of royal jelly inhibited glucose 6-phosphatase, which is a key enzyme in gluconeogenesis, by inducing the expression of adiponectin and adiponectin receptor 1 and phosphorylated AMP-activated protein kinases in abdominal fat, thereby improving the hyperglycemia. Another research reported that anti-diabetic effect of royal jelly on 20 healthy volunteers who underwent the standardized oral glucose tolerance test, also known as OGTT, and afterwards a second OGTT after the ingestion of 20 grams of royal jelly. Serum glucose levels after 2 hours and the area under the curve of glucose were significantly lower after royal jelly administration. As for anti-cancer effect, royal jelly has inhibited the proliferation of human breast cancer MCF7 cells induced by environmental estrogen bisphenol A. 10-HDA has shown to reduce the level of tyrosinase-related proteins 1 and 2 and also microphthalmia-associated transcription factor in B16F1 melanoma cells. Another study on 10-HDA has shown the effect on vascular endothelial growth factor, which is one of the pro-angiogenic proteins characterized as an inducer of cancer neovascularization. Treatment with 10-HDA suppressed VEGF, induced tube formation, and inhibited migration and proliferation in human umbilical vein endothelial cells. Antibacterial activity has shown high activity against yeast, gram-positive bacteria, and in minor way gram-negative bacteria of royal jelly and its principal compounds. The royal jelly has proven antimicrobial effects of Candida, Staphylococcus, Klebsiella, Salmonella, Streptococcus, and even Listeria monocytogenes and Pseudomonas aeruginosa. The main antibacterial components of royal jelly are 10-HDA, proteins gellinase 1, 2, and 3, and royalism. Other benefits reported in the literature are improving erythropoiesis, glucose tolerance, and mental health, but also anti-allergic activities by reducing antigen-specific IgG levels. And also a research on nematode C. elegans has shown the substance can extend the lifespan, which suggested that royal jelly may have a lifespan extending capability. As for children's apitherapy, I feel obligated to emphasize that royal jelly should be used as a food or supplement only after an allergy test. We have gathered some researches in the last few years, amongst which is the research on improvement of overall physical condition. A group of authors have presented research that has studied effect of royal jelly on young football players. The experiment was carried out on 25 players aged of 12, separated in 2 groups. First, experimental group of 15 young boys was given a supplement of royal jelly for 2 months, and the second of 10 boys, the control group, did not use the supplements. Measurements were taken before the experiment started and at the end of the experiment. Observed characteristics were body height and mass, muscle, bone, and fat component, diameter of elbow, wrist, knee, ankle, circumference above elbow, forearm, above knee, and of lower leg. The experimental group had a statistical higher values in body height and mass, muscle and bone component, and lower average value in fat component of the control group. As we heard in a lecture before, professor has told us about their upper respiratory tract infections. They have described that the mixture of bee products, honey, pollen, and royal jelly, and its effect in children with URTI. They conducted research with 104 patients, aged 5 to 12, separated into four groups. The patients were evaluated for bacterial and viral infections. Two groups were separated for viral infections, and one of them had a bee products and one with placebo, and the other two groups were for bacterial infections, with one only with antibiotics and the other one with combinations of antibiotics and bee products. Patients with viral infections receiving a mixture of products show earlier improvement compared to the placebo group, and also in the patients with bacterial infections receiving antibiotics and mixture of products show better recovery than those received only antibiotics. None of the patients developed any reactions or side effects to the mixture product. Already mentioned SLE, which is the most common type of lupus, which is autoimmune disease that attacks its own issue, causing the widespread inflammation and tissue damage in the affected organs. It can affect joints, skin, brain, lungs, kidneys, and blood vessels. A group of authors studied the effect of fresh royal jelly administration on the disease course in children with SLE with some immunological markers. The study conducted 20 SLE children who received 2 grams of freshly prepared royal jelly each day for 12 weeks. The percentages of markers were significantly increased after royal jelly treatment when compared to the baseline values, and the apoptotic CD4 T lymphocytes were significantly decreased after royal jelly therapy when compared with baseline and control groups. Results show improvement with 3 months royal jelly treatment with regard to clinical severity score and laboratory markers for the disease. As for malignant disease, there have been presented research in which they have studied the effect of royal jelly on children with malignant disease, such as acute leukemia, lymphoma, and hepatoblastoma. All the patients had 1 gram of royal jelly before breakfast once a day for a month, and during this period, the complete blood count, general condition, and weights of the patient were recorded. The values of the same patient before and after the use of royal jelly were examined as a control. The general condition have increased and weight gain were observed after royal jelly administration. The patients who had royal jelly gained approximately 1.737 plus minus 0.725 kilograms after 1 month of administration of royal jelly. As for complementary and alternative medicine, a group of authors described effects of complementary and alternative medicine, amongst which royal jelly on children with asthma. The parents of asthmatic children were invited to participate in a questionnaire-based survey of 13 worldwide and 5 local methods of CAM. Current asthma treatment, asthma exaggerations, emergency admittance and hospitalization due to exaggerations, and parental education levels were investigated as a predictor that influenced the use of CAM. 150 of 304 asthmatic children used some form of CAM before, and the most common among them were quail eggs, herbal medicine, Turkish wild honey, speleotherapy, and royal jelly. They have concluded that the asthmatic children who used CAM, including royal jelly, showed higher treatment scores than children who hasn't used CAM. As for other benefits, Bogdanov has written in his book that royal jelly is a functional food and thus an ideal additive for prophylactic purposes. He has described many researches on pediatric population from 1959 to 1997, among which are influence of royal jelly on infant nursing food that contains royal jelly and pollen in comparison with infant food without these ingredients. The infants fed on B products had a better adaptation in stress situation. Another described research is of Kirillov and Sokolsky, who prepared a tablet containing 45 milligrams of dry royal jelly, 30 milligrams of ascorbic acid, and the resting 265 milligrams containing lactose, sucrose, starch, and calcium stearate. The authors have noticed that the better influence was on lower immunity students who were beneficial by this, measured by normal ratio between blood albumin and globulins ratio, and also the content of A, B, and G immunoglobulin proteins. As for dosage, the Strand and associates have given a recommendation for dosage of royal jelly for different age of groups, fresh royal jelly. They have said that the premature infants should start at 50 milligrams a day and go up to 250 milligrams a day, or 0.25 grams a day. Infants age, actually months 2 to 12 months old, should start at 0.5 grams a day for growth and development, strength, and immune and nervous system. Children 1 to 5 years old should get 0.5 grams a day for low immune system, anemia, nervous system impairment, weakness, and loss of appetite, or 1 to 3 days of 2.5 grams a day for acute infections and colds. Children 5 to 12 years old should start at 0.5 to 1 gram a day for low immune system, anemia, nervous impairment, weakness, and loss of appetite, or 1 to 3 days of 5 grams a day for acute infections and colds. Bogdanov has also given recommendations of 20 to 100 milligrams of fresh royal jelly, but he did not specify the age of the children. As for adverse effects and allergies, in literature, there have been mentioned anaphylactic reaction, acute asthma, contact dermatitis, vomiting, and diarrhea, and thus royal jelly should be used as a food supplement only after an allergy test. Of course, the high risk is for patients suffering from asthma and anaphylaxis. In conclusion, we can say that royal jelly is an important functional food that possesses multiple health-promoting properties, and although the effects of royal jelly in anti-diabetic, anti-tumor, immunoregulation, memory regulation, and other aspects have been proven, there should be more studies to prove the effect on children. And collaborative studies are needed, especially those involving participants of research from different scientific areas, such as chemistry, biochemistry, biotechnology, biology, physiology, nutrition, and medicine. And I believe that would be all. This is our bibliography, which you will be able to see later, I believe. This is our Apitherapy team members, Martin Lalić, myself, Zdenka Lalić, PhD, and Andrija Lalić, MBA. The Apitherapy, this is where we all come from, is the only Croatian manufacturer of medical and pharmaceutical products that are based on bee products, which are manufactured in controlled conditions according to pharmaceutical standards, and that is why we're unique in the European Union, but also the world. Thank you very much.
Thank you very much, Anna, for your presentation.